Hello, welcome again to my YouTube channel. This is where you learn the health conditions at the comfort of your home. Now today is a video about the Azoospermia, the nil sperms. So this condition more likely to cause the male infertility. So if you have been struggling about the infertility, you need to watch this video so that you can get the main cause of this male infertility. Remember to subscribe, share this video to anyone you think he or she can benefit from this health video. So when I talk about the azoospermia, I mean the condition whereby a man's semen doesn't contain any sperm. So it's more likely to cause male infertility. The other thing is that it's more 1 out of 100 men suffer from this condition. So it's not a common condition, but it can affect any man. So the other thing is that it doesn't show any signs and symptoms. One needs to go to the hospital for the doctor to take the history, do the examination, and some tests so that to determine if this man is suffering from azoospermia. So some genetic tests, some imaging of the testicles to determine the cause of this azoospermia. Now the other thing we need to check about is the sperm production. How is sperm produced so that we can come up with this azoospermia? Now the sperms are produced in the testicles by the process called the spermatogenesis. Now then again, they are being stored and they mature in the epididymis. Now, once they mature and they are being stored there during sexual stimulation, the sperm's gonna move or travel to the vas deferens, to the prostate, where the secretions are going to be added. Then it become now what we call the semen, and then it's gonna be ejaculated out of the penis via the urethra as what we call the semen. However, in this condition, there is no sperm that are going to be in this semen. Now, what are the main causes and maybe the types of this azoospermia? Now, one is obstructive azoospermia. From the word obstructive, it means there's something obstructing, maybe in the reproductive system, the male reproductive system. Now, one is what we call the blockage of the reproductive system, maybe in the first development, maybe some infections in the what we call the epididymis, or some tumors that are blocking. Now, sperms are unable to travel because there is a blockage, there is an obstruction. So the main causes of this is some inflammation, infections, and previous surgeries that you have undergone. So these are the ones that causes obstructive azoospermia. The other cause is what we call the non-obstructive azoospermia. This, there is no any obstruction, but it can be due to hormonal or what we call the testicular dysfunction, maybe due to chromosomal abnormalities such as missing the Y chromosomes, which is more on this sperm production. The other thing is maybe an extra X chromosome. So these chromosomal abnormalities can cause this non-obstructive azoospermia. The other thing is undistended tests. The other thing is what we call the re-exposure to radiation and the chemotherapies. This can also lead to azoospermia, non-obstructive azoospermia. Now, one needs to go to the hospital because there is no end sign and symptom, and no one can know whether he is suffering from this azoospermia. You need to visit the fertility doctor for the examination history and the investigations to be done for you to get the right treatment of this azoospermia. So you may get some treatments such as the testicular sperm extraction and what we call the percutaneous epididymal sperm aspiration. So these are some of the treatments, but you need to go to the hospital. Just get a fertility doctor, and then you need to get of this. If the diagnosis is made, then you're gonna get the right treatments. So this is the end of this video. Kindly remember to watch, subscribe, share this information to anyone you think he or she can benefit from this video. Thank you.